So there's a bunch of different models in what's going on during COVID. I'm sure you guys are all dealing with different aspects of this in your child's schools and in your school districts. These kind of take place throughout both public and private educational settings. And it's really very different everywhere you go. Sue and I were chatting before we came on, and we're both experiencing different ways that these are presented. First of all, all of our kids have obviously, prior to COVID, had in-person learning, and many of them are having that opportunity again. Hybrid would mean that you would be in person some days or parts of some days, and doing learning at home, whether it's synchronous or asynchronous, and we'll get to that next, for the rest of their time. And then synchronous means that you're at home or away from the school, and that your teacher is teaching you live. So it's live direct learning from a teacher. Asynchronous means that your teacher has put up assignments or videos, or sometimes they have little app lessons for you to do with questions and things, so that the students would work on those things without the direct teaching from your teacher. Concurrent means that a teacher would have a set number of students in the classroom and some students at home. And then online, would just mean that you're taking all of your classes online. And often that means that you do not have synchronous learning. It's not direct. It's more of an asynchronous approach with a lot of videos. But there are a lot of online classes these days where there is live teaching, and there's a combination of the synchronous and asynchronous learning. So before I move on, is everybody already familiar with that, or has anybody experienced any of that? Yes. Okay. Okay. All right, good. I had to remember how to move the slide. I haven't done a slideshow in a little while. I apologize for that. Couple of things. We're just doing a couple of quick slides related to COVID, and then we're going to go on to just the regular information on how to advocate for your child at school. But a couple of things that are specific to COVID that we need to take into consideration is, at least in my school district, our clinics have been devoted to kids who have COVID symptoms. So if your student, if your JMer needs to take medicine midday, or if they have, if they need to, if they're tired or fatigued and they need to go lie down for a little bit, or have sunscreen applied, you need to figure out where they're going to do that, because it's not safe if where all the kids with COVID symptoms are congregated waiting for rides home is the clinic. You need to work out with the school an alternate place to do the things that you used to do in the clinic. And the other thing to consider is immunosuppression. Some of our kids can get pretty significantly immunosuppressed while on the JM medications. So you need to talk with your provider, with your doctor, and you can watch the labs as they come in. If you have like a really low ANC or white blood cell count, or if you're on rituximab and your lymphocytes are bottoming out, you may know the history, depending on when your child was diagnosed, you may know how your child reacts to having those low numbers. And that might be a time when you might want to keep your child at home. And so you would want to make a plan with the school and your provider that your child could stay home for a couple of weeks while waiting for those labs to improve. So are there any other questions that you guys would have directly related to COVID? And you can bring some up at the end, but I just wanted to ask if there's any that you're thinking of ahead of time. Going with the silence. Okay, Sue, do you want to start on this piece?
Sure. Interventions versus accommodations and modifications. Accommodations and modifications are things that are done to the regular school day that fall under the umbrella of general education. It does not fall under the umbrella of special education. An IEP falls under an intervention under the umbrella of special education, meaning the child has a separate plan and separate needs beyond the needs that can be met in a general education classroom. The other intervention would be a non-binding agreement between you and the school for interventions that would also be done outside of the classroom beyond the general needs that can be met within the regular education classroom. Okay, an IEP versus a 504 plan. The basic description. An IEP is a blueprint or a plan for a child's special education experience at school that is separate than their general education classroom. And what it means is that the child has needs that cannot be met by their general education teacher and needs to be addressed by a specialist. A 504 plan is a blueprint or plan how your child will have access to learning at school, what their regular school day is going to look like. Quite often, a 504 plan is done, and here in different districts, it's different people. I know in my school district, it's the school psychologist who does the 504 plans because it is not a special education piece. I'm not involved in it, being a special education teacher. What it does, an IEP gives individualized special education and related services to meet the unique needs of the child. Academic needs, occupational therapy, physical therapy, speech therapy, any of those fall under the umbrella of special education. A 504 plan provides services and changes to the learning environment to meet the needs of the child adequately as other students, how their regular education classroom can be modified to meet their needs. As with an IEP, a 504 plan is provided at no cost to the parents. Both of them are done once a year. You can call a 504 meeting or an IEP at any time during the school year, and the team will get together and meet with you to discuss your concerns. Otherwise, they are done on a yearly basis. What law applies? Individuals with disabilities, the IDEA is what applies to special education, and Section 504, the Rehabilitation Act of 1973, is what covers a 504 plan. Okay, they are both federal programs. The special education is under special education laws by the federal government, and the 504 plan is federal civil rights laws that stops discrimination against people with disabilities. It makes the curriculum accessible to all. Health plan, totally separate document. You can have a health plan in addition to your 504 plan or your IEP. Typically, in your IEP, in your notes and in the section that lists accommodations would be all of the things of the health plan, and then would be listed the nurse or the health clerk who would be providing those services. So it's part of the same document typically. Some districts and some states do it as a separate document attached to the IEP or the 504 plan. This is done via requesting a meeting with the school nurse or the school health clerk. And yeah, it is definitely best to check the website for the name and contact information. Hopefully, if each school does not have a school nurse, it does have a health clerk who works directly under the district nurse. Prepare, request a physician letter, download What is JM from the Cure JM website and provide, and create a list of symptoms which affect your child at school, such things as vomiting. And that typically children have to wait 24 hours and be fever-free before they can return to school. But if vomiting is a side effect of medication, your child shouldn't have to have that waiting period. And you would state that in a health plan. Muscle weakness may need to adapt PE and or help taking notes, opening bottles. Another one would be carrying books for a middle schooler or high schooler. Meet with the nurse. Typically, you are also meeting with another school personnel, be it the school principal, the school psychologist, the school counselor. You're going to educate all of these people on JM because you at that point are the expert, not the school nurse. Prepare a plan with the school nurse that would include symptoms and what to do, and understand that the health plan is provided to all staff who work with your child. A copy of it goes to the general education teacher. It would go to the PE teacher. It will go to anybody who works with your child during the day. Are there any questions on what those 3 plans are or what they would look like? Okay. Next
I
slide.
also, if these plans are created and you have, for example, a PE teacher who's still, and your plan says that my child's not supposed to go outside during PE, and you have a PE teacher who insists that your child goes outside, you can come back to the school and say, hey, this isn't being followed. So that the teachers are required. This is not a law. This is not a legal document, but the teachers are still required to follow what's in a health plan. That's, the school has put it together for the purpose of teachers following that plan. Whoa, it's not moving. Move. There we go. This is just a framework for a position letter, and this will go up on the website, I believe. If not, you can always email me and I'll send it to you. But basically you give your name, your child's name and their age. And what I've done is I've filled out some of this stuff and sent it to a doctor, and then they usually put it together and send it back for my kid when we're looking for that. And we've done this letter is used both for not just both, for the health plan, for your IEP, for your 504. Okay, for a 504 plan, basically this is the plan that documents or that takes care of just the accommodations. It does not involve special education. So what you're looking for here is what is going on in my student's day that is hard because of any disability that my child has. And lots of our children have more going on than just myositis. A lot of our kids also are dealing with some anxiety or depression or fatigue, or they might have some ADHD going on, or they might have a lot of irritability as a result of the steroids. I mean, this disease is not just for very few students, is it just as plain as just the symptoms that are related specifically to myositis. So think through your student's entire day, from the moment they walk out your door until the moment they walk back in, and what is hard. So you're going to want to think about that, and then let's talk about where the disability hits. So in order to get a 504, you have to prove that your child has a disability, and you want to gather evidence of that disability, and that's going to be your physician letter or anything that states the diagnosis. You go to the CureJM website, which gives information, again, what is JM from the CureJM website, to find out in order to have the information to present. And then you're going to figure out who the school's 504 coordinator is. In some schools, our school district just merged the coordinator, not the programs, but the coordinator for our 504 and our special education process, because we were finding that if somebody came into one and needed to go to the other, then they had to start over. So our school district just did that. I'm guessing that's still unusual, and you'll need to figure out what the pathway is to get into 504 versus the pathway for IEP. And we'll go a little bit more in depth as to which is which here in just a moment. And Sue looks like she wants.
If you can't find easily the person at your school site, contact the district office, and you're going to contact the Office of Special Services, which includes special education, 504 plans, behavior plans, et cetera, et cetera. Contact the district. They will put you in touch with who it is at your school site.
Yes, that is correct. So she just told you what to do. You figure it out for your school. If you can't figure it, usually you can call the school office and they will tell you who that person is. If they're not being helpful, go higher. If your school counselor, if you contacted your school counselor, they can often help get this process started, but sometimes you're going to find people that are going to not move the process along, just to be polite about it. Advocating for your child is not as simple as, my child has all these needs and the school system says, oh yes, they do, and everything is happy. Sometimes you have to work to make this whole thing happen. It's not always a nice, clear road. So then you're going to write a formal request for a 504 plan. When you do that, you're going to say, my child has the following disability. This is how it impacts my child. And I'm going to be bringing a physician letter to our meeting. You do not need to give all of the details, but you need to be able to state a couple of pieces so that they know that this needs to happen. And then if you don't hear back within a couple of days, follow up, send a polite email, keep going. You need to hear back from them. When you go through the 504 plan, the evaluation process, you're going to get teacher input. There'll be some observation. You'll get to input. You've heard me say this a bunch of times, a physician letter, provide what is JM from the Cure JM website. And then that's all the pieces that are going to happen on your end and on the school's end. And all of that will come together in a meeting. So then you'll have this meeting to determine whether or not your child qualifies for this 504. Be prepared to advocate. As I said before, be ready. Sometimes this can be a battle. Not every school is accommodating. And then there are schools that say, oh, we're going to do all these things for your child. You do not need a 504. You don't need a legal document. You want a legal document. And if they won't give you a legal document and it becomes a war, go ahead, take the non-binding agreement. And if it works, come back around and say, you know what, this is working really well. I want a legal document because I'm not always going to be at this school. So to create the actual 504 plan, I mentioned this before, consider all the areas of weakness for your child. This is assuming that they were approved to get a 504. Then you need to create the plan. So consider everything. Is it hard to, if I think the very first thing that's hard for my son is standing at a bus stop. If it takes the bus 10 minutes, if he's standing at the bus stop for 10, 15 minutes, now he's too tired to do well in first. So we actually have a school bus that comes to our house and picks him up so that he's able to at the top of the stairs instead of standing at a bus stop, for 10, 15 minutes. And then I apologize, my computer's making noise. And then there's a list of suggested accommodations on the Cure JM website, but really you can be creative with this and the school can help you and you can ask around and you can Google. There's all kinds of different ideas for how to address difficult things for your child. If the backpack is too heavy and your school doesn't allow rolling backpacks, maybe your child gets a rolling backpack, or maybe your child keeps their textbook in their classroom and a textbook at home. Some of these things aren't as relevant now that we're moving away from textbooks, but some of the heavier things like the binder, maybe your child's binder stays at school and your child doesn't need to take the binder back and forth, or vice versa, it stays at home. I don't know, but there are ways to address almost anything. So I do want to go a little bit deeper into the difference between the 504 and the IEP before I have Sue start in on the IEP, which here's a list of accommodations. But I do want to go to a little bit, these are all what you see here, all of these things are accommodations. The specific list actually comes from an IEP, but this could also be a 504 that you're looking at. So, you look at modifications to the PE curriculum, but my son is very tall. So he has classroom seating to have extra leg room. He's got an elevator key because his building is 3 stories tall. But this is just a list of different accommodations. My son gets frustrated. And I don't know if I'm going to see that on here, but if he gets really frustrated, at one point he had a pass that he could just flash to a teacher, and that would allow him to leave and go settle, calm down someplace because he was having, a bad day. Or if he was in a lot of pain, he could flash this pass and he'd go to the clinic. So my kid spends a chunk of time in the clinic due to the fatigue and chronic pain that he has. So he's developed, you can see that there, flash pass for unscheduled breaks. So all he has to do is flash it. He doesn't have to wait for the teacher's attention. He just needs he can get up, and as he's walking out the door, he can flash the pass. So again, he has reduced homework because he spends so much time at medical appointments. There's just all kinds of different things that you can do. I mean, this is a pretty broad list of accommodations, and I'm sure that you guys and many other people have even better accommodations than my son does. For the IEP, the big difference in experience for your child in having an IEP versus a 504 is that the IEP provides people who provide direct assistance in learning to your child, or assistance in It could be assistance in physical therapy if your child is struggling to access the building, or occupational therapy if they're having trouble writing. But it provides a human being, whereas everything under a 504 is just an accommodation that the school makes for your student. And Sue, do you want to take off on IEP?
And the other thing about, excuse me, qualifying for an IEP is you will sign an assessment plan and the child goes through a series of assessments. If the thought is that they need academic help, then the resource specialist is going to do academic testing. The school psychologist will do testing to determine if there's a learning disability that would require that academic support. A speech therapist, an occupational therapist, a physical therapist, all of those can be involved in the assessment. Now, what you want to watch for when you sign that assessment plan is what all people are going to be involved in that assessment. If it isn't listed, occupational therapist or physical therapist, don't assume that's going to happen, because it won't. It's got to be listed. They can't say, oh, well, pending on these results, then we'll discuss. You want all of that assessment done in the beginning. You don't want to delay the process of the IEP or delay the process of your child getting those services. So all assessments should happen at the very beginning. The school district has 60 calendar days to provide those assessments. Vacations don't count against those 60 days unless they're over 5 days. So if you have a 5-day fall break, the calendar does not stop. It keeps going. And the IEP must be held within those 60 days, or the school district is out of compliance. And then they're in trouble with the state, and it goes from there. So school districts will do everything possible to have that IEP within those 60 days. Does your child need services accommodations? 504 is your accommodations. The IEP is accommodations and services or specially designed instruction. All of your accommodations that are to your regular education class are listed as part of the IEP. So a 504, typically, some districts do it separately, but typically you don't need a 504 in addition to the IEP. The IEP is a broader document and would include all of those accommodations, plus all of the needs of which the specialists are addressing. Next page.
I just wanted to quick mention that there are, when you do an IEP, there's 13 categories that you can be found eligible under. And JM is, because it's a health impairment, it affects your child's health. Actually, ADHD even falls under here. It qualifies under other health impairment. And I pay attention to that, because you want to make sure that they don't say, oh, well, your child isn't deaf, or your child doesn't have autism, or your child doesn't have, all these different things. Your child has JM, and JM qualifies under other health impairment or OHI.
And while it qualifies, they then have to have a discrepancy or a need that would involve the use of a specialist to help the child meet their needs. If they don't need the use of a specialist, even though they qualify as OHI, they're not going to get an IEP.
So to get these documents, get in 504, your child has to have a disability. And by having JM, all of our children have a disability. Let me just state that. But there's different levels of impact for any disability that a student might have. And so the next thing you have to prove is you have to prove that this disability is making it difficult or making it impossible for your child to access their education. And that's the social emotional education, as well as the actual academics and learning and the physical accessibility within the building. So that's you. If you can prove those two things, then you can qualify for a 504. And then to get the IEP, you then prove that you need a human being, as in a special education teacher, or occasionally perhaps just a physical therapist or someone, but you need a human being to provide support in order for your child to be able to access their education. And I want you guys to write down the words access education, because that's a key 2-word phrase. And if you are struggling to get services for your child, you need to say, my child is not able to access his or her education because of this. And if they deny you, then you can show that your child is not accessing their education, they have now denied your child's ability to access their education. So those are keywords.
Okay, the initial meeting, typically before you have been given an assessment plan, is a student study team meeting, a student success team meeting. It's got different titles, but there's a meeting that includes your child's general education teacher. Quite often it will include another general education teacher at the approximate grade level. I know in our school district, we also include a general education teacher. If it's a primary student, then we include an upper grade teacher or vice versa, because you want that perspective of what they should have learned or what they should be learning. Excuse me, we've got a dog toy going in the background. It includes those people. It includes the principal. It may or may not include a specialist. Typically, they like to keep the specialist out of that meeting because at that point, we're not making a determination for special education. So it is a general education function, okay? You want to make sure that you've got with you the what is JM, your physician letter, a list of your child's symptoms and medications and the side effects that those medications may cause. You want to include anything that you know in previous years that your child has had difficulty with, or that your child has had difficulty with at home, that may help in your diagnosis of determining the need for an IEP. The student study team meeting is done. At that point, it is decided whether to move forward with a special education assessment for an IEP or to move to a 504 plan. If you move to the assessment of the special education, you're given that assessment plan, and from the day you sign it and date it, the 60-day calendar begins, okay? At the end of 60 days, there is an eligibility meeting. Each person who has tested your child will be there to present their results. You'll have an opportunity to provide updates and any additional documentation and data that you've collected. And then the team will discuss and determine if your child qualifies for an IEP. To qualify, these things must be true. Your child has a disability. Yes, we know that they have myositis. Is the JM preventing your child from accessing his or her education? There's that important phrase that Michelle talked about, accessing the education. And the only way your child can access his or her education is through specially designed instruction provided by a special education service, be it academic, speech, physical therapy, occupational therapy, whatever it is, okay? At that IEP meeting, as well as discussing all of the results, the team will then propose goals, things to work on with your child in any of the areas that they have considered to be a deficit, what they're going to do and how they're going to get there. And they have a year to meet those goals. And these are not the same as your standards in your grade level classrooms. These are goals that are written specifically to the needs of your child. Updates are then given either semesterly or quarterly, depending on how your report cards work. With then at a year, has your child met those goals? And what would be the new proposed goals at the next IEP? Or if your child has not met those goals, it is not okay to rewrite the same exact IEP goal. If your child didn't meet that goal, there's obviously a problem, and we need to go back, and those updates that are sent to you semesterly are going to help you understand why didn't they meet that goal, and that goal would be rewritten for the next year. All of those things, and then all of your accommodations, your modifications are listed in the IEP. Any accommodations for testing, the state testing that is done, those would be listed in the IEP. Health plan, anything from there would be included. Let's see what else. I'm trying to think. What else, Michelle? Anything else? It's typically an IEP is 15 to 20 pages long. So beware, it's a lot of paper. You will also get a complete psychoeducational report, which is just a report of all of the tests that were conducted, the norms for those tests, and your child's levels of achievement on those tests. And then at the end, a recommendation is usually made whether the child would benefit from an IEP because of being OHI, or if there was a learning disability, speech and language disability, whatever the disability is listed at the end of the full psychoeducational report. Then the IEP is developed separately. So you'll come out of it with two separate documents, both of them very long and pretty full encompassing.